Hi, I'm Kirsten Noams. I'm one of the staff surgeons at the Esophageal Institute at the Allegheny Health Network in Pittsburgh. And today I wanted to talk a little bit about gastroesophageal reflux disease, or GERD, and why it's a really important health issue. It is very common, impacts a large percentage of the population, and despite how common it is, with nearly 60 million people in the U.S. experiencing at least monthly symptoms and around 15 million people with daily symptoms, there's a lot that is misunderstood about it. What people call heartburn is actually a symptom of GERD and reflects the movement of acid and stomach contents into the esophagus. People also commonly can experience the sensation of food or fluid moving backwards in their throat. Sometimes they may experience difficulty swallowing. And while these are the common symptoms associated with GERD, there are many other less common symptoms that people aren't familiar with. These can include cough, throat clearing, increased mucus production, adult onset asthma, a hoarse voice, nausea, abdominal pain, and belching. Sometimes all a person may experience is cough. They maybe have seen an allergist, a lung doctor, an ENT, and no one can quite figure out what is going on. And it turns out that the cough is actually GERD. At the Esophageal Institute, we encounter folks with GERD with all sorts of symptoms. So it's always important to keep an open mind when you have symptoms like this to consider GERD, at least as a potential cause. Some of the other common misconceptions that come along with GERD are how to treat it. Commonly, people will start with an antacid like Tums, which are kind of a quick on, quick off approach to treating reflux symptoms. And they do work well for people who have rare symptoms of heartburn. Other types of medications are acid or H2 blockers. This is like Pepcid. These medications can be taken intermittently and also tend to work quickly. The most frequent medication prescribed for persistent GERD symptoms, though, is a proton pump inhibitor, or a PPI. These are medications that, in order to be effective, must be taken daily and should be taken generally 30 minutes before a meal on an empty stomach. The important thing to know about these medications, though, is that while they can be very helpful for relieving symptoms, they don't actually stop reflux. Patients continue to have reflux, they just don't tend to feel them at all or as much. Another important consideration for patients who think that they have GERD is to consider the possibility of other causes. There are quite a few diseases that can mimic GERD, and patients can go for years being diagnosed as having GERD, though in fact don't actually have it. This is important to know because with a correct diagnosis, a more effective treatment plan can be developed. Some examples are patients who have an esophageal motility disorder, such as achalasia, or slow stomach emptying, like gastroparesis. We help treat these patients as well at the Esophageal Institute. We help diagnose patients with all sorts of stomach and esophagus, voice, and swallowing disorders here. The evaluation process at the Esophageal Institute is comprehensive and includes several diagnostic studies. Typically, we provide patients with endoscopic evaluations so that we can see the inside of their stomach, esophagus, and the first portions of their small intestine called the duodenum. We also will measure for reflux disease, and we will also evaluate esophageal function with high-resolution manometry. Additionally, we may consider radiology studies like a barium swallow. Sometimes further studies are needed to get more information, and this can further evaluate swallowing dysfunction and stomach emptying. This detailed evaluation helps accurately diagnose patients as well as informing individualized treatment plans. Our diagnostic and therapeutic plans include some of the newest technologies as well as the gold standards in care. Our plans can range from medical management to endoscopic interventions to surgeries, as well as integrative care that includes nutritional assessments as well as behavioral health. A very important part of the work we do is to raise awareness for esophageal cancer. In the United States, since the 1990s, there's been a 600% increase in the rate of esophageal cancer. In the United States, adenocarcinoma is a type of esophageal cancer that has become more common. It is a type of cancer that is generally associated with GERD. Often patients diagnosed with this type of esophageal cancer will note that they occasionally have had heartburn over the years, but many may not have had any symptoms at all. Currently, there are no screening guidelines for esophageal cancer like there are for breast or colon cancer. While the prevalence for those types of cancers is far greater, esophageal cancer has the potential to be caught early. Often, before a person develops esophageal carcinoma, they have what is called Barrett's esophagus. This is a change in the lining of the esophagus due to reflux. Over years of reflux, these cells can become abnormal and evolve into cancer. For any patient who has Barrett's esophagus, it is important that they have routine surveillance endoscopies. For these patients, there are guidelines that suggest endoscopies should be completed every 2 to 5 years to check on Barrett's esophagus and make sure that there are not concerning changes. At the Esophageal Institute, we provide a comprehensive screening and surveillance program for Barrett's esophagus and provide consultations for anyone who is curious to know if they should be undergoing endoscopy. With early screening and appropriate surveillance, it may be possible to prevent the evolution of esophageal cancer or catch it at a very early stage where cure is a possibility. I think one of the most important things that we provide patients at the Esophageal Institute is the knowledge so they can make informed decisions about their health. We have a lot of information on our Facebook, Twitter, and YouTube channel. Feel free to check us out and give us a call.